What's happening, guys? Dr. Brandon Welch, aka the Pharmacy Athlete. And today, man, we gonna put you on some game. I'm talking about some serious game that helps take your performance to the next level. And today we're gonna talk about nutrition and athlete bone health. I can't tell you the amount of stress fracture injuries that I'm constantly reading about. And I think that through nutrition and understanding the right training load, since this is an overuse injury, I think that we can reduce our risks of these stress fractures. My athletes, man, especially my top ones. I like to see you guys on the field, man. I don't like to see you guys on the sidelines. I mean, look, man, if we can get this right, why not? Right. And so I want to bring awareness to you guys as well as the coaches of certain signs, symptoms, or anything from a nutritional aspect of things we can do to help prevent these injuries from happening. And so oftentimes you see a lot of stress fractures in high impact sports such as soccer, lacrosse, rugby, the NHL, even sometimes even football. And so it's very important for us to be mindful of our increased risk of stress fractures based off of the sport that we play. And so back to it being an overuse injury, right? So any type of high volume, high intensity training where the body is overloaded. So we're we're adding too much load from our training bout to our muscles on a consistent basis. So again, too much high volume, high intensity can increase our risk of stress fractures. And so we really have to have a periodized approach when we're trying to write these prescriptions for our training sets, is because we don't want to do too much high intensity and high volume training too frequently throughout the week, right? Maybe mix it up with some plyometrics, some neuromuscular training, um, something with a good blend, something to kind of decrease that risk of fractures. And so, in addition to these stress fractures, just to put you guys on some game, give you guys some jewels, man. In case you didn't know, around 90% of peak bone mass is attained during the athlete's early 20s. And so we have a window, right? That's very crucial for us. So especially my teen athletes, my high schools, late adolescent stages, where our growth plates are still essentially open and our bones are growing, it's important that we have the right training strategy and nutrition plan to make sure that our bones are very durable and they have the right strength. In fact, man, to take things a step further, the amount of bone mass, often referred to our bone mineral density, which is what we're going to get into a little bit later, is attained by the time an athlete is 30 years of age. Is about the highest they will have across their lifespan. I'm going to say that again. So the amount of bone mass attained by the time an athlete is 30 years of age is about the highest they will have across the lifespan. And so after 30, what happens is our bone turnover starts to increase little by little, right? And so it's harder to recover those bones that could be potentially brittle. It's hard to recover them back up. Now, here's one of the beautiful things about our bones, in case you guys didn't know. Bones is the only connective tissue that has the ability to regenerate, essentially has the ability to really heal itself. And so when we think about the bones, it being unfortunately very sensitive, and sometimes our bones can be very weak and brittle, even though we may have a tibia fracture here and there. The good thing is with the right physical therapy and the right nutrition, the bones do have the ability to kind of heal itself. And it's not only bone mass, right? We also want to take into account the strength of the bone, which relates to the ability to resist the strain that's placed on it. So this can include its geometry and micro architectural structure, right? And so sometimes, you know, understanding that geometry and the microarchitectural structure of the bones is just as essential as building its bone mass and bone strength, right? Unfortunately, the consequences of long-term bone health could be pretty high, right? And it's about one's life, but also quantity, right? So, for example, 1/5 of individuals requiring hospitalization for fragility fractures can really kind of put them at risk, right? And so, what's the best way to determine long-term bone health in athletes, right? And so, sometimes trainers or sports medicine doctors, medical doctors, they can request what's called a DEXA scan. So the DEXA scan not only can test your bone mineral density, again, which is like the strength of the bones and the durability, but also has the ability to test your body composition. And so you'll see two scores once you do a DEXA scan, right? And so you can use the T score, which kind of compares how much one's bone mass deviates from the bone mass of the average healthy 30-year-old. Or you'll also see what's called a Z score that compares the average bone mass to people of the same age and gender. The reason for this is that many athletes would be considered smaller. So, for example, marathon runners, jockeys are larger, rugby, pro forwards than the average individual. So these general population comparisons, sometimes, I'm not going to lie, could be misleading. Now, moving over into nutrition, right? And so nutrition is actually one of the best recovery strategies. And we think about what the bones are actually comprised of, full of rich minerals such as calcium, magnesium, potassium, phosphorus. And so just as important, the training is just as important as also the nutrition to kind of help better support bone health, right? And so it's clear that bone can be influenced by diet and nutrition. We know that across the lifespan. As bone starts to turn over, right, it tends to be reduced with feeding when compared to fasting. And so when individuals are fed both bone formation, excuse me, guys, gain, and likely to a greater extent bone resorption, which is considered bone loss, rates decrease acutely. And so just to dive right into some of the nutritional aspects that we can use to kind of help support bone health. I know we talked about calcium. So calcium, a major bone forming mineral, right? And so bone stores 99% of the body's calcium. Wow, man, 99% of the bone's calcium is actually stored inside of our bones, right? Low calcium levels in the diet can contribute to a catabolic, which is called a breakdown effect on the bone through the activation of what's called our parathyroid hormone. Now, some good sources of calcium. So we got dairy, so milk, cheese, yogurt, spinach, kale. Make sure you're being rich on those green leafy vegetables, man. Not only are they a rich source of calcium, but they're also a rich source of other key minerals, right? So enjoy your collard greens, enjoy your spinach. Soybeans, white beans is also great sources of calcium. Now, phosphorus is also a great source of a mineral that needs to be obtained to help support good bone health. So phosphorus plays an integral role in bone formation as it's an essential constituent for the mineralization of bone. And low phosphorus levels can contribute to an impairment in bone mineralization. So sometimes when I'm working in collaboration with a sports medicine doctor, I'm often asked, okay, hey, Dr. B, what labs should we order? And bone mineral phosphorus is always a lab I request alongside of iron studies, a CMP, complete metabolic panel, and then also vitamin D. Vitamin D is essential, which is what we're going to get into next. These are kind of like those key minerals and vitamins that really help support bone. And so vitamin D, right? And so vitamin D is responsible for storing calcium, roughly about 60 to 70% of calcium, and then also storing anywhere between 30 to 40% of phosphorus. And so you can eat all the phosphorus and calcium you want, but if you don't have enough vitamin D, It's just going to simply be excreted, right? And so vitamin D is kind of like the rate limiting factor to help really support bone growth, right? And so make sure you get a lot of your fatty fish when it comes to vitamin D. So this is tuna, mackerel, salmon, herring, egg yolks are rich in vitamin D. So making sure we're hitting some of those key nutrients. Now, moving over to magnesium. Ooh, it's getting warm. It's getting warm. Let's get it. So more than half of the body's stored magnesium is in the bone, and it plays an important role in organic matrix bone synthesis. So we need to make sure that we're having enough magnesium. Magnesium is one of those minerals that's responsible for over 300 biochemical reactions inside of our body, right? And so making sure we're consuming the right amount of magnesium is going to be important. So back to those green leafy vegetables, spinach, kale, your collard greens, those are going to be key food sources that we want to make sure we're getting enough magnesium. Also your nuts and seeds. So your almonds, hemp seeds, flax seeds, chia seeds, even quinoa, which is a pseudo grain, and then also avocado is going to have rich amounts of magnesium. Now, protein is something that we really don't want to miss. It's anabolic, right? So protein is meant to help build up bones. It's a contributing factor to help build up bones, but it's also obviously, as you guys know, contributing factor to help build up muscle. So part of the organic matrix of bone for collagen structure is proteins, right? So the role in the production of hormones and growth factors that modulate bone synthesis. Protein has a strong possibility that has an indirect effect on the bone due to support of muscle mass and function, but also the increase of circulating levels of insulin-like growth factors, which has an anabolic effect. And so I'll use the example of, I also see patients that have osteoporosis, right? And so osteoporosis is pretty much a condition where your bones get very weak. So when your bone mineral density score, so you remember that we talked about that DEXA, starts to become negative 1.5, negative 2, and above, that's when you run the risk of having osteoporosis, where it really increases your risk of fractures, is because your bones start to get very brittle. And the reason why I'm bringing this up is because when your bones get too brittle and you have that bone mineral density score of like a -3, they put you on a medication called like Temlos, right? Which is essentially called an anabolic agent. Whole purpose of that anabolic agent, it's like a 34 amino acid sequence chain type of medication, is it's meant to help build the strength of those bones back, right? And so protein is going to be a key factor. I usually recommend, especially in my young athletes, anywhere between 1.4 grams per kilogram of their body weight to about 2.2. To make math simple, you can easily do 0.75 grams times your body weight. I think that's a good indicator too. And then we have some of our other smaller trace minerals that I'd say, like copper, zinc, boron, manganese, potassium, iron, vitamin K. A lot of these trace minerals can actually serve as what's called cofactors. So they can be contributing factors to help kind of push some of these enzymatic reactions to help with bone metabolism, right? And so essentially, making sure you're also getting enough fruits. So raisins, prunes, blueberries, these are strong antioxidants that can help with bone metabolism. And then as far as our potassium, bananas, broccoli, Brussels sprouts, nuts, seeds. And then again, as I mentioned before, when it comes to a lot of my high school athletes, if I'm ordering labs, iron studies is going to be something that I definitely order to assess stress fractures, is because iron has important roles in vitamin D metabolism and collagen synthesis. So it goes back to me saying, like, hey, these trace minerals serve as cofactors for other enzymatic reactions. And so, bam, there you go. Collagen synthesis and vitamin D is your hallmark example. So now, what are some of the issues specific to the athletes when it comes to these stress fractures and bone health? Now, despite the fact that many of dietary requirements underpinning bone health during growth and aging would be similar in the athlete to the general population, there are some dietary and nutrition challenges specific to athletes, right? These can include energy availability, low carbohydrate availability. We already touched on protein and vitamin D. And then one of the things we're really going to dive into that is sometimes overlooked is dermal calcium and sodium losses. And currently, right, we consider these to be the main issues that are pertinent to the athlete. But the list isn't exclusive, of course. So let's talk about energy balance for a second, right? And how this relates to an athlete's bone health. So energy balance is simply defined as total energy expenditure minus total energy intake, right? So it's that balance of how much energy we consume from our calories versus how much energy we're actually expending from probably our training, right? And so with energy availability defined as dietary energy intake minus exercise energy expenditure adjusted for bone mass, right? So as such, the two differ slightly in the following ways, right? The estimation of total energy expenditure required for the determination of energy balance may introduce more sources of errors compared to solely the measurement of exercise energy expenditure. So in theory, individuals may be in energy balance, but experience low energy availability. And so it's very important that we make sure that we have good energy balance, right? So I always say it's like when it comes to energy balance, it's almost like a seesaw, right? So we can have positive energy balance where we tip it one way, and then we can have negative energy balance where we're tipping it another way. But essentially, we want the body to be in homeostasis. And so we want everything to stay balanced, right? Now, low carbohydrate availability, right? So low carb diets have increased in popularity. I've also seen a lot of patients or athletes per se starting to do, have these vegan diets, which can then put you at increased risk of stress fractures. Vegetarian, keto diets. I mean, some of these diets are very selective, and you could be missing out on these key nutrients that can be helping with bone health, right? And so when it comes to low carb availability, we need to make sure that we're dialed into the amount of carbs that we have to load our body. And so that way, as we're practicing, we're training, or even in game day, we're not expending too much of our calories and not compensating it with the amount of fuel that our body is essentially demanding, right? And so for a sport like soccer, for example, and I'm going a little bit off topic here, is because you'll understand why. And so the body has three energy systems, right? And so the body has what's called the phosphagen system, which relies specifically on carbohydrates. So it's an energy system inside of our body that our tissues essentially use this energy within the first 20 seconds, right, of carbohydrates. Now, our next energy system is called our anaerobic energy system, which is our glycolytic system, right? And so this energy system, our body uses energy within the first 30 to 60 seconds, right? So it taps into that. And so typically any type of high intensity exercise, this is the energy system our body taps into. Our last energy system, which is called our aerobic energy system, also known as oxidative phosphorylation. This is where our body goes through at least 12 steps of metabolism and enzymatic functions to help utilize energy sources. And so this is the last energy system that our body essentially uses. And it's typically preferred for, endurance sports, such as soccer, as I mentioned, where you're competing at high intensity for a long period of time. And so typically you want to prioritize your fats because they are more long-standing carbohydrates, not carbohydrates, but they're more long-standing energy sources than carbs. Carbs are quick, right? Our body uses carbs first, very fast. But when our body's done using carbs, it needs to shift over into using fats, right? And so if we don't periodize our nutrition plan where we have that good balance of carbs, fats, and proteins, then it's easy to fall into this category of low carbohydrate availability, which can increase our risk for stress fractures, right? And so there's some recent data to suggest that low carb availability might even act negatively on the bone independently of energy availability, although further research is required to confirm these early findings. And so there's no studies yet, but it's starting to come out, right? The effects of low-carb diets on bone health in athletes showed a reduction of 50% in bone resorption loss following an oral glucose tolerance test. This is actually a study done in 2002. So somewhat pretty relevant, right? And so, again, making sure that we're loading our body with the right carbs, right? In addition, an article from 2015 have shown a post-exercise reduction in bone turnover following carbohydrate feeding during a 120-minute treadmill run in recreational active individuals. And so making sure, again, guys, we're dosing our body with the right carbs, something to look at from a nutritional standpoint. Now, dermal calcium loss, right? This is very, very important. I want us to lock in as I'm talking to you about this, right? And so athletes who undergo a high volume of prolonged exercise might be at risk of losing calcium through sweating. Remember, I mentioned earlier, 99% of calcium is actually stored inside of our bones. So it's very important, again, that we're mindful of how much calcium is being lost through our training bout, right? So at risk of losing calcium through sweating, which could, in some circumstances, reach a level that might cause a decline in serum calcium concentrations. And so calcium in small amounts is actually stored inside of our sweat pores, right? And so it can easily be excreted and sweated out from, all the sweat that we can be losing from, heat acclimatization. So if we have outside workouts or even indoor, right, training at these high intensities, and to kind of break down the mechanism, right? So as we start to have a decline in serum calcium concentrations, right, should this happen, you'll see an increase in the parathyroid hormone secretion occurs. That would promote the breakdown of bone to release calcium into the circulation to defend the serum calcium levels. So essentially, as our body is losing calcium from, excessive sweating due to our training or our game day, what happens is our parathyroid hormone increases. And what it does is it pulls calcium from bone, right? And so that's how our bones can become very brittle, increasing our risk for stress fractures, right? And so it's suggested that supplementing with calcium before or during exercise might compensate for dermal calcium losses and defend the serum calcium levels, meaning that there would be no concomitant increase of parathyroid hormone release or bone resorption or bone loss. And so, hey, it may not be a bad idea to supplement with calcium prior to game day. My recommendation, if you're going to supplement with calcium, I'd supplement calcium carbonate. It's a more bioavailable form of calcium in comparison to calcium citrate. Calcium citrate has its benefits too, but it's a little bit more acidic. So calcium carb is the way that I would go. Right. And so remember, guys, when we're talking about stress fractures, just to kind of wrap things up, athletes should consider a well-conducted nutritional assessment of their dietary intake to identify whether or not they are consuming the required amounts of these key nutrients to help underpin bone health. Although this could be fraught to be difficult. I understand, right? It's not always easy to track our nutrition down to the deep science like that, right? Hey, not everybody can be that pedantic. So energy availability, right? We talked about that. And so it's ideal to support bone health in athletes. Although this can be unrealistic target for many, current knowledge would suggest trying to achieve an energy balance above 30 kilograms, 30 kcals per kilogram of lean body mass to minimize the negative effects on the bone. Low carb diets, we talked about that, might negatively influence an athlete's bone health. However, there's not enough studies available to provide a direct evidence. Lastly, guys, or last two things I have here. Athletes often consume 2 to 3 times more protein than recommended daily amounts of the general populations. So we talked about that sweet spot, right? 1.4 grams per kilogram to about 2 to 2.2 grams per kilogram of your body weight. To make math simple again, just do the 0.75 grams times the body weight for a more simpler equation, right? And so that can essentially help. Now, if an athlete's vitamin D is deficient or insufficient, it's recommended that a serum vitamin D level above 50 nanomoles is achieved. And so making sure vitamin D is adequate. And the dermal calcium, we kind of talked about that, how that can be stored in our sweat pores, and then also in our skin. So dermal calcium loss does actually exist. Remember, we talked about the mechanism. It increases our parathyroid hormone, leading to bone resorption, which is essentially bone loss, because it pulls calcium from our bones. So you can always consider supplementing with calcium prior to a training bout where you were training in high heat and you know that you're going to sweat a lot, just to be safe. Better to be safe than sorry. So my last recommendation for you all, I probably said this already. I promise this is my last. Just make sure you get a DEXA scan every year to check your bone mineral density. Make sure you're getting blood work done at least twice a year for my athletes. I would say checking your complete blood count, your CMP, your complete metabolic panel, looking for certain outliers that can be consistent with leading towards stress fractures. Hemoglobin, hematocrit, on your CMP. I'd make sure that we look at, sodium, chloride or calcium levels, making sure you're ordering a vitamin D, checking for a bone mineral, phosphorus, ordering those labs. And then, as I mentioned before, making sure that you order iron studies. So checking ferritin, which is a protein that helps store iron, checking your total iron binding capacity. These things really matter, right? Is because, as I mentioned before, some of these minerals are considered cofactors, right? So especially iron. Iron serves as a cofactor to help with bone metabolism by helping with collagen synthesis, which is very important. And so, okay, that's it. That's my spill. That's the topic of today. How can athletes keep good bone health? And let's keep training at the highest level. All right. Again, Dr. B. Welch, aka Pharmacy Athlete. Let's go.